So the first case we had was a 71-year-old patient with splenomegaly, a mild anemia, a high symptom score, and had intermediate 2 risk disease. So in that patient, the panel commented that they certainly felt the patient needed some treatment, right, based on his spleen and symptom and the anemia. And in that case, there were folks who favored momelotinib just because of the anemia. There were some discussion about his symptom burden and spleen and whether, and the survival data related to myelofibrosis, related to ruxolitinib early on. So there was some discussion about considering ruxolitinib. But as I recall, the predominant recommendation was to think about using momelotinib in that case with the mild anemia. Yeah, so in the kind of second line or not treatment naive setting, and in this patient where her predominant issues were certainly anemia and it's a little bit of symptom scoring and a fairly big spleen. The favorable, the panel thought that, again, this would be a patient that may benefit from momelotinib just because of the anemia at 7.2. So that was a little more of a clear cut case, I would say, compared to the first one where folks were kind of on the fence a little bit, I would, in those discussions. So that was kind of, especially since she was refractory to ruxolitinib. In the 54-year-old female, in this case, she had a combination of both anemia and thrombocytopenia being problems, with the platelet count rated about 34. And so the discussion here was really whether they're around pacritinib versus momelotinib, and whether that platelet count made people a little bit nervous, given that on the momelotinib trials, depending on which one it was, she may or may not have been eligible for that trial. And so that was the discussion was probably to favor pacritinib in this case, just because of the thrombocytopenia, although I don't think momelotinib would have necessarily been a wrong choice either, given the inclusion criteria for most of those trials. So that was I think folks favored pacritinib in this case.